Welcome to Part 2, the Clinical Day. In this presentation, I will discuss a general schedule of activities for each clinical day, things to do on the first day, making student assignments, conferencing, and some evidence-based teaching learning strategies that will help you work with and assess students. So what does the instructor do? The instructor provides a plan for each day. It's important to have a backup plan, too, for low census or any other unexpected events. We make student assignments, conduct pre- and post-conferences, and provide student feedback, and more about this a little bit later. But let's start with the first clinical day. We know that each day does not need to be the same, or is it possible? Depending on the length of the rotation as well as the objectives and the clinical site. The first day is a great day to do a general walkthrough of the unit, meet the charge nurse and as many of the staff nurses and other staff by name and title. Students need to know all of the people that we work with in the clinical area, not just the other nurses. Students need to be shown where the bathrooms are, where they can get a drink of water, and the cafeteria. What are your expectations for them if they want to go to the cafeteria or leave the unit? Do you all go together for a meal, or do you assign lunch times or break times for them? This needs to be addressed in the written expectations, and make sure you reiterate this once they are all together in the clinical site. Is there a break room for them? Are there any do's and don'ts of the particular nursing unit? Where will you meet them before each clinical day? Point this out while you're walking through the agency. On the first day, you can have a scavenger hunt after you orient them to the general area. A scavenger hunt handout is in the clinical toolbox, and Gaberson offers a general unit scavenger hunt too. You can ask your mentor to look it over and help you make it more specific to the unit. You can make this scavenger hunt as long or as short as you like. After you have used the tool, you might want to individualize it for the information you think is the most important. Over time, I know that I started adding other information such as how to find a phone number for dietary and pharmacy, the policies and procedures, and things like that. The scavenger hunt is fun for the students, and it really lightens the mood. It also helps to pair the students for this activity. It kind of goes faster, and it helps them to get to know each other, and it brings down the anxiety and helps them to feel more comfortable with the surroundings, especially if they've never been to the facility before. After all the students have arrived to the predetermined meeting location, you will discuss the plan for the day. What are the priorities of care for this particular day? Depending on this objective, you will make the student assignments unless you've already done that the night before, and it may also depend upon the clinical setting. Make sure all the assignments and expectations are understood. During the conference, have the students tell you their plan. This helps to reduce their anxieties. You can encourage the students to think about what they're learning, but this may be more appropriate at the end of the day. I strongly encourage you to keep your pre-conferences succinct. Get your students out on the floor preparing to care for patients. Time is limited, and while discussion is very helpful, actual hands-on is the purpose of the clinical experience. Let's talk a little bit about the different types of clinical assignments that you can make for students. Assignments can range anywhere from observational to total patient care, or the preceptor model, where the student is assigned to the nurse. Assignments can be focused care or focused role. You can concentrate on medication administration only or only on patient assessments. They can concentrate on communication skills such as listening or giving report as well as taking report. They can practice the SBAR technique for communications. And if they're focused on a specific role, they can focus on the charge nurse role or on the wound care nurse in a long-term care facility. Or they can rotate to a different unit. Let's say going from med-surg perhaps to the emergency department or to the perioperative area. And here are some general guidelines for an alternative assignment, one that's off the unit. Take the time to properly prepare the student with the expectations. As I mentioned earlier, make sure that they understand the goal and the objectives for going to that alternative site. For example, if the student is rotating from med-surg to the perioperative area of surgery, What are their objectives for that day? What are they supposed to be doing? Are they there to observe handoff reports? Are they there to practice IV starts? These suggestions may sound simplistic, but I can assure you that students may not know what the expectations are. Therefore, this is why it becomes very important to clearly communicate your expectations for any assignment, especially when they're off the unit. If you weren't clear with them, then they may return without the experience that you had intended for them. When the student returns, make sure you properly debrief the student. Additionally, consider having the student complete a reflective journal entry about their observations. This way you can see what they feel they learned from the experience and then clarify any misconceptions, should there be any. And it's been my experience that it's really easy for the untrained eye, as in the novice nursing student, to miss as well as misinterpret the experience. Are there any preclinical day assignments for students to complete? Here's some of the tasks that some instructors require of students. Prepare a care plan or a concept map, look up their medications. The question is this really practical anymore? Is it practical on the unit in which your students will be practicing? For most inpatient acute care facilities, patient stays are very short, and all too often students have completed all of their prep work and they arrive completely prepared and find that their assigned patient has been discharged. Now what? Well, of course, they receive a new patient care assignment, and then they have to complete all their prep work right there, right now. So again, should we still have them do all their prep work the night before? In her article, White discusses this concept, and if you haven't read it yet, please do so for more depth. We still need to go over the medications, patient lab data, and the patient's plan of care with the students. White notes in her article that the students get much faster at getting prepared when they do it on site. And isn't that what we all have to do as nurses? We don't get our patient care assignments the night before. Regarding medications, one strategy that has worked well for me, depending on the clinical site, is to give the students a preclinical assignment to look up a list of frequently administered medications. This information can be kept in the student's journal, and they can refer back to it at the time of medication administration. You have to use your own judgment. Use what you think is the best way to go about that preclinical assignment based on your particular situation, the level of the student, and the School of Nursing's routine. I'd like you to listen in on a seasoned nurse educator as she discusses her struggles with making student assignments. I do want you to realize that the next video is about 30 minutes and 28 minutes and change long, and it comes from the CUSIN modules.